Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. The result is chronic pain. It's termed failed back surgery syndrome, known as FBSS for short. FBSS is one of the most frustrating things a patient can deal with, since he or she went the surgery route hoping for a pain-free outcome, and it just didn't happen. Studies show that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than they did before the surgery. Each additional surgery performed has a lower chance of success than the one before. Overall, it can be exceptionally depressing. Why does FBSS occur? Well, there's a number of reasons. It could be that surgery is performed for the wrong reason. There's a 50% rule. Even the best fellowship training, board certified spine doctors get the diagnosis for back pain wrong about half the time. It could be that surgery is performed for the correct reason, but the person was just left with residual pain. Okay, and this could be even with a technically perfect surgery. It could be inadequately performed surgery. It could be that the fusion just didn't occur and the hardware broke down and the pain shot up. It could be that the outcome was satisfactory initially, but then scar tissue formed around nerve roots. It could be that the hardware became painful, or adjacent segment degeneration. Here's an example of adjacent segment degeneration. You have a two-level fusion. Hardware looks good, okay? But then up here, normally you have a rectangular space for the disc that you can visualize. Here it's a little small triangular, very significant breakdown. There's overgrowth of bone between these two levels. So on the MRI of this, you can see these two levels are fused. This level has severe disc breakdown. What are the symptoms of failed back surgery syndrome? It could be daily back pain that radiates out into the flank or into the buttocks, spasms and aching, possibly some sciatica-type symptoms of leg pain and burning. Treatment options: first and foremost, the patient should have a surgical evaluation to see if a revision might help for either broken hardware or adjacent fractures or whatever the reason. If that's not the answer, then physical therapy can be beneficial, chiropractic treatment. Spinal decompression therapy is a great treatment that provides intermittent computerized traction. It's contraindicated, though, if hardware is already in place. Acupuncture has been shown to be helpful along with medications. The medications may include over-the-counter anti-inflammatories or Tylenol, possibly some muscle relaxers for short-term periods, possibly some opiates for short-term periods. Then there's also some non-narcotic medications such as tramadol. For interventional procedures, there are quite a few. Trigger point injections can be helpful for the spasms and the aching. Injections around the hardware can be diagnostic and therapeutic. They can tell the pain doctor whether or not the hardware is producing some of the pain. Facet or medial branch blocks are injections either into a facet joint or around it to relieve pain. So for instance, if you're having adjacent segment degeneration and pain, that can be very helpful. Epidural injections, if there's a nerve root being involved, and causing leg pain, sciatica, that can be helpful. Here you see a radiofrequency ablation. If a facet or medial branch block injection works and then it wears off, that can either be repeated or the person can go on and have a radiofrequency ablation at that level where it kind of deadens these little sensory nerve endings called the medial branches. That can provide pain relief for 6 to 18 to 24 months. A spinal cord stimulator implant is an excellent last resort option. It's been revolutionary for failed back surgery. They've dramatically improved over the past decade to where now most of them have over 200 programming options available, and they're good for both back and leg pain. Over 3/4 of patients do extremely well with these implants. Keep in mind that it doesn't fix the problem, but if it cannot be fixed, you might as well mask the pain. The top non-operative pain management in Texas is through the Texas Pain Network. There are several pain clinics throughout the state, including Austin, Texas, where over 50 insurances are accepted and over 25 treatment options are provided by the board-certified physicians. Visit us online today at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.